Hi, I'm Matt Toronto, and I'm so excited to introduce to our AesthetiCare family our newest member, Amanda Whitson. She is a nurse practitioner, and Amanda is going to be heading up our new division called AesthetiCare Wellness. And we're so lucky to have her. She has got a wealth of experience, and we're just going to take a few minutes and talk about AesthetiCare Wellness. But first, Amanda, tell the people out there a little bit about yourself, your background in wellness, and kind of what you like about this industry.
Yeah. Well, Matt, first of all, I'm really excited to join the AesthetiCare team. And I have a real passion for wellness medicine and personalized regenerative and functional medicine. I'm board certified as a family nurse practitioner, but over the last 4 years, I developed a passion for bioidentical hormone replacement, which kind of segued into my passion for overall wellness. And I completed a fellowship and am board certified in anti-aging, regenerative, and functional medicine.
Yeah, you did that with the American Academy of Anti-Aging Medicine, which is
did.
wonderful. So, there's been such a big buzz all over the country, and it's really coming to Kansas City about all these different things in wellness, and really looking, instead of, so many doctors look at a symptom and address the symptom, but more looking at the overall health of somebody and preventative and quality of life. And so let's start with hormones.
Yeah.
A lot of people have heard of bioidentical hormones, but I don't think a lot of people know exactly what it means to balance your hormones.
Mm-hmm.
So I have a great testimonial. When I had my hormones checked for a man of my age, my testosterone level, Western medicine said, hey, anywhere between 300 and 1200 is fine. Well, mine was on the lower end, around 400. And I love the idea of anti-aging medicine, say, hey, let's get you up a little bit higher towards the better range. And so now mine's about 1,000. I got to tell you, I feel so much better. So kind of tell us what it means to balance your hormones and how that can kind of change the way a person feels.
Oh, absolutely. So hormones are really imperative to overall health. They are the chemical messengers of basically every cell in our body. So if they're out of whack, then the rest of us is probably not going to feel really well. Hormonal changes can develop anytime in women, really in their 30s, men in their 30s as well. So figuring out a starting place as to where to start to balance hormones is really important. And as you mentioned, normal is not optimal. So those scales, from the 200 to 900 or 1,000 range for
It's
male
a huge
testosterone.
range,
Yeah, those are based on male studies anywhere from like 18 all the way to 100. So finding out where you fit in that scale is really important. And it really is about your symptoms and listening to your symptoms and figuring out how to proceed from there to develop a personalized treatment plan.
So when you talk about symptoms, when somebody has hormones that are out of whack,
Mm-hmm.
and then they get them balanced or in the optimal range,
Mm-hmm.
what do you see, what changes do people feel?
Yeah, so oftentimes symptoms of hormonal imbalance can range from anything from joint pain, fatigue, insomnia, weight gain, obviously low libido, and in women, hot flashes. When those hormones are optimized, you will begin to notice an improvement in those overall symptoms, start sleeping better, feeling better, and underlyingly at a cellular level start functioning better.
Yeah, and for me personally, what I felt is what you just said, sleeping better. One thing, my workouts, my extras are so much better. My energy levels are better. I know I've heard that sometimes with men, if hormones are out of balance, they have a very hard time, maybe women too, losing weight.
Yes.
And that helps when you get those hormones balanced. I think people, they hear hormones and think, oh, it's just, increased libido and sexual stuff, but it's so much more than that.
It is so much more than that. And in fact, it's some of the things, it's not so much symptoms sometimes, it's functions in the body, such as cardiovascular health for men and women, brain health, which is huge, and bone health.
Yeah, and for me, one thing I noticed is my cholesterol went down when my hormones were balanced. Walk us through when somebody comes in, what happens? Obviously, there's a consultation, but then you do the blood work. Kind of tell them how that works.
Yeah, so the process is you come in for a consultation, and we do a pretty thorough medical history, looking at family history, personal history, and then obviously symptoms, certain medications you're on. And going from there, we then check your lab work to determine your baseline. We then, with your lab work and your symptoms, put together a personalized treatment plan for you, because not everybody, this is very personalized medicine, and not everybody's going to need the same thing. So it's really tailored to that person as to what hormones need to be optimized or replaced, and how we proceed with doing that.
Yeah, one of my employees here, female, told me a while back, said, once she got her hormones where they are now, they're optimized, she goes, I would give up my car before I gave it. It's changed my life that much. So I think that's such an exciting part of what we're going to do. Another area that I'm just so excited about is the kind of the regenerative medicine. So we hear a lot about biologics derived from a placenta, or some I know are done by bone marrow, fat, but to me, what I've been studying over the last year, what that can do for arthritis and joint health and overall wellness and some of the studies going on, it's amazing. So talk a little bit about what we plan on doing for the regenerative medicine area, everything from the joint health to hair and all those things.
Yeah, so regenerative medicine is a new, exciting, and cutting-edge field in medicine, and it uses cells from your body, and oftentimes donor cells, and we can apply those to really anywhere in the body to regenerate those areas, whether it be from a sexual wellness standpoint, a hair restoration, inflammation in joints, joint pain, and just overall anti-aging purposes. We can also use them in aesthetics, which is really exciting as well.
Yeah, I think there's been some great studies using biologics for things such as burns, and really with lasers and stuff, what we're doing is a controlled burn, but better healing, improved outcome. I have a number of friends who now have done this, ex-athletes, with bad knees, bad elbows, and they're using these biologics directly injected, and the change is amazing. For me personally, and I've had 2 IVs now, I've had 5 knee surgeries, I have arthritis in both knees, I have virtually no knee pain. Tennis elbow, which I had for years, is gone. But I will tell you, the overall, I don't know if I've felt this good in years. And so it's so exciting with all these studies going on. And the one nice thing about these products is they're totally natural. And tell people kind of the safety profile of this.
Yeah, so some of the safety profile from what we have now is really good. And as you mentioned, there's little to no downtime. These are non-surgical, safe, non-medication options, so you don't tend to see those side effects like you do with some of the medications, or even joint injections that use steroids, which actually do more harm than good. So it's really offers kind of a natural way for your body to really regenerate and heal itself.
Yeah, and I think that's so exciting. And using these biologics for things like hair restoration, where PRP, platelet-rich plasma, has been out for a long time, but it really hasn't worked very well for hair. And we're finding using these more potent biologics can really stimulate hair growth. Men who are thinning, balding, women with thinning hair.
Oh, yes.
And then when you go to another thing that you're going to be addressing, and that's sexual health, using biologics for what we call the O shot, the P shot, vaginal rejuvenation. Talk just a little bit about that.
Yeah, so traditionally the O shot, known as the orgasm shot, and the P shot, known as the Priapus shot, those have used PRP, as you mentioned. Well, PRP is really dependent upon the quality of your PRP at whatever age you are. So oftentimes we will add these biologics in addition to the PRP, and we will get better outcomes just by the nature of the little nanovesicles and the young immature cells. We tend to see much better results.
Yeah, and I think it's so interesting because for men, if you listen to sports talk radio, every other ad is about sexual dysfunction or ED. And this is instead of just taking medication for this is a way to address those things for men and for women, not only to improve the quality of sex but the ability for sex. Some great things for women who are cancer survivors, who may have trouble with lubrication, painful intercourse. It's really amazing. So, we are so excited. What we found, and I think this is true, at AesthetiCare, we have just so many people coming in, and they have things they want to look better. Most people want to look better, they want to feel better. Most people who feel better, they want to look better. So I think the marriage is good. We've got some wonderful physicians on our advisory board that guide us in this. Amanda is a wealth of knowledge. Before we end, tell people what is your favorite part about this job, because you've worked in a lot of areas of medicine, and now you've gravitated towards this anti-aging wellness. what is it you love about it, and what do you hope to see in your clients, your patients?
Absolutely. Well, it's really my passion to make people really feel better. And in traditional medicine, I mean, you can do that with management of symptoms, but here we really are addressing the root causes, whether that be, hormonal imbalances, regenerative issues. And so it's really exciting to be able to really help people address those issues and have a real answer for them. And just seeing people feel so much better, it just makes this kind of work. I mean, it's truly a blessing to be able to do this.
Well, and I know in your past in this, you've helped people who are going through chemotherapy, who have been ill, Lyme's disease, things that are tough for regular medicine to deal with.
Yes.
So we're so excited about AesthetiCare Wellness. You can come make an appointment to see Amanda for a one-on-one consultation and kind of see where you are health-wise, have a good discussion with her about your goals, and you're going to love it. This can be truly life-changing. So we really look forward to seeing you here at AesthetiCare and AesthetiCare Wellness. And again, we just want to welcome Amanda to our team, and it's going to be wonderful.